Racism is any distinction, exclusion, restriction, or preference based on race, color, descent, or national or ethnic origin, which has the purpose or effect of nullifying or impairing the recognition, enjoyment, or exercise on an equal footing of human rights and fundamental freedoms in the political, economic, social, cultural, or any other field of public life. Unquote. From Article 1 of the United Nations International Convention on the Elimination of All Forms of Racial Discrimination. In this video, I explore 4 out of the many ways that racism existed or still exists in healthcare systems. And because oftentimes the person perpetrating racism may just be doing what is acceptable in society, which is the definition of systemic racism, I also offer a way for victims of racism in healthcare to have a polite and constructive conversation with the healthcare provider that might knowingly or unknowingly act racist towards them. Number 1. Pulse oximeters. This is a device that measures the oxygen concentration in the blood. This is also known as oxygen saturation. People with low oxygen saturation will need oxygen therapy supplement. They may also need to be admitted to hospital for this emergency treatment. The most accurate way to measure blood oxygen saturation is to stick a syringe into the arm and draw blood for analysis in the laboratory. But this is too invasive for patients that may need their blood oxygen saturation to be monitored frequently. It is just not practical to keep sticking people with needles, say every half hour to draw blood. So, health technology experts designed a device to place on the finger or on the earlobe to read blood oxygen levels. The device works by shining red light and infrared light into the skin. It will then detect the ratio of the amount of red light absorbed compared to the amount of infrared light absorbed. Based on this ratio, the device will calculate the percentage of blood oxygen saturation. The problem is that dark skin affects the accuracy of some pulse oximeters, meaning that the device may show that a dark-skinned person has normal blood oxygen saturation when they do not. There is no evidence that this is a deliberate act of racism by the manufacturers of pulse oximeters. In fact, pulse oximeters can also show inaccurate readings for white skin. However, inaccurate readings are more common among dark-skinned people. Inaccurate readings on pulse oximeters happens 3 times more frequently for people with dark skin compared to people with white skin. There are several studies that show how black people were refused the appropriate treatment because the pulse oximeter shows that they have normal blood oxygen saturation, and in some cases this can lead to death. The racism here happened inadvertently because historically medical devices are tested on young white men. This means that most manufacturers have not adequately tested their pulse oximeters on all skin colors that will use it. In 2021, the Food and Drug Administration of the US mandated that 15% of people to be used for testing pulse oximeters must have dark skin tone. But there are pulse oximeters out there manufactured before 2021, and they are still being used in hospitals and clinics today. Doctors and nurses and other clinicians need to be aware of this, and people with dark skin need to understand how to have a conversation with their healthcare provider if they find themselves in a situation where they feel sick, but the doctor says that their pulse oximeter reading is normal. So, if I find myself in a situation where the pulse oximeter reading does not reflect how I feel, I would ask the doctor or nurse to use a different brand of pulse oximeter. If that does not work, I would ask that my oxygen saturation be measured directly by arterial blood gas analysis. This requires drawing blood and analyzing it in the laboratory. Up next, how to qualify for kidney transplant. Based on data from the Global Burden of Disease studies in 2019, more than 4,000 people in the world die on a daily basis because of kidney disease and because they could not get a kidney transplant. There is a list of people waiting for kidney transplant in most countries. This list is typically a ranking list of people who deserve it more, meaning that the higher you are on the list, the earlier you will receive a transplant. One of the factors for calculating how high anyone should be on the kidney transplant list is the glomerular filtration rate, or GFR. This is a measure of how well your kidney is removing waste from your blood. In 2009, in the United States, the equation for calculating GFR had a racial component or factor in it. This formula from 2009 will consistently show that the kidney of a black person is performing about 16% better than the kidney of a white person of the same age. Therefore, the black person will be ranked below a white person of similar levels of kidney disease or severity of kidney disease on the transplant register. Was this a deliberate attempt to deny black people of important treatment? There is no evidence that this is so. What is known, however, is that the inclusion of race in the GFR equation is not strictly based on science. Instead, it was based on belief when they could not find an explanation for the science. The scientific fact is that the way that creatinine affects the GFR of black people is slightly different from the way it affects the GFR of white people. However, science has not been able to explain the difference. In the absence of an explanation, it is not possible to create an accurate equation to explain the difference. But that was exactly what they did in 2009 in the US. Keep in mind that several equations for GFR existed before 2009 and they did not have a race component. Because of this unscientific belief-based equation, the death rate among black people waiting for kidney transplant was about 4 times higher than the death rate among white people. And black people were less likely to receive kidney transplant in the US. Fortunately, in 2021, a new formula for calculating GFR was created, and it does not include a race component. The third issue of racial bias in healthcare that I would like to discuss is pain management. Many studies show that if a person who is not white has acute or chronic pain, they are less likely to get adequate treatment for their pain compared to their white counterparts, even if both of them are treated by the same doctor or nurse in the same hospital. The question is, how did this come about? Firstly, there is no machine or physical device for measuring pain in the clinic or hospital. Pain is measured clinically by using subjective methods like the visual analog scale or the faces pain scale. The visual analog scale is a line that is 10 centimeters long. The left end of the line is denoted as zero pain, while the right end of the line is denoted as the maximum amount of pain possible. The patient must mark their perceived level of pain on the line. To use this as the basis for providing pain treatment, the doctor or therapist must believe that the patient has accurately indicated their level of pain. This belief factor should not be part of the doctor or therapist's decision-making process at all. If the patient is cognitively competent, the belief of the doctor should be irrelevant. But what we see in reality is that many doctors and therapists believe that Black people have higher pain tolerance and that the pain of Black people is not as painful as the pain of white people. Hence, Black people receive less pain treatment. This is a belief system that has not gone away despite the fact that it has been known as a racial bias for several decades. So, where do we go from here? Well, if I feel that I am not receiving adequate care for my pain, I will initiate a polite and constructive conversation with the doctor.
Doctor, you are probably aware that people who are not white typically receive inadequate pain treatment. I would be grateful if you could reflect on the possibility that this might be happening to me right now.
Yes, I understand that it is difficult to be polite when you are in pain, but if one could do this, I believe that it will create food for thought for the doctor or therapist. In the worst case scenario, I would ask to be transferred to the care of another doctor or therapist. Now for the bonus content. The ideas and words of a person in the corridors of power can easily become government policy and law. Case in point is R.F. Kennedy Jr., who is about to become the Health Secretary of the United States. He has many ideas based on his personal opinions. For example, R.F. Kennedy believes that the immune systems of Black people are better and more efficient than the immune systems of white people. Hence, he believes that Black people should have a different vaccination schedule compared to white people. Now, I have not seen any elaboration of the different vaccination schedule that RFK Jr. has in mind, and I think that it would be irresponsible of me to speculate. But if this kind of belief is not challenged and nipped in the bud, it could lead to the type of systemic racism in healthcare that we have been discussing so far in this video. Thank you for watching. This is Basic Hale.